What is a cancer in a very simple term?
Cancer basically is a disease, just like nowadays it has become quite similar to diabetes or blood pressure.
What are the other visible symptoms or most prominent symptoms people should be aware or careful of when it comes to cancer?
Many a times people just deny, or there is more than actually knowing or more than actually understanding that there is some change. It is more of the denial of the patient.
Okay. The lump with the pain or the lump without pain, which has a higher probability?
Whatever you do treatment, they won't respond.
Okay.
Many times the patients call, why it is not responding?
Are you excited about this, the new advancements in AI? Do you think that will enable our diagnosis system?
AI will help us. We have to learn how to use it.
Right.
I have made my department completely paperless. One of my friends once said, who was in army, that एक बार अगर मैं गलती करता हूँ तो मैं मर जाऊँगा, लेकिन तू गलती करेगा तो
Hello and namaste everyone. This is your host Unbinary Kundan and I have something exciting for you. But before I jump onto the episode, I have two requests from you. The first one, I really want you to invest your time and please listen to the whole podcast, and I'll give you the reason why. Today I have somebody on the podcast who saves life, and who knows, after this podcast he might be saving somebody's life from in the audience group. We all know about cancer, right? And you including me, as in what we know is that the cancer kills. But I'm sure after having this conversation, something would change. And something would change as in that not anymore. I want you all to enter this podcast episode as somebody who knows about cancer. But when we are done with this podcast, I want you to come out as somebody who's aware of the cancer. The second request which I have is that please subscribe to the channel, because we put lots and lots of effort. The whole team works with the production, calling the guests, take their time. So I highly recommend you to subscribe to the channel. That encourages us to create many such amazing stories, which is helpful for the whole society. Before I jump start, I want to let you know that this podcast is sponsored by a creative and a branding agency called Ramantram. These people believe in creating the visual excellence for all the good ideas. So if you think you have a great visual idea, or if you are a business, you should reach out to Ramantram. With that, I would like to jumpstart this conversation. Dr. Suman.
Hi.
Hi. Welcome to the UnbinaryLife podcast channel.
Thank you, Kundan, for considering speaking to me.
So, doctor, before I could jump to the questions, I just want you to let our audience know that who you are and why should they trust you.
Well, I am a doctor by profession, but more importantly, I am a human being with a passion for life. I deal with human life rather than a patient. One of my friends once said, who was in army, that एक बार अगर मैं गलती करता हूँ तो मैं मर जाऊँगा, लेकिन तू गलती करेगा तो तेरा पेशेंट मर जाएगा. तो इसलिए हम दोनों का जो importance in life is completely, we have our preferences, and that really caught me. And that is where I always thought that I am responsible for the life of the person.
So tell us something more about your experience, your education, as in what made you the expert what you are today?
From my childhood, I have been a guy from Sainik School, Bhubaneswar. We have been there in the school from class 6th to class 12th. After that, I went to medicine, and just to tell you that I was a hardcore fan to join the defense forces.
Okay.
Unfortunately, I was not selected by the defense forces. The services selection board, I flunked 4 times. Then I got through the medical entrance, and then I thought that maybe this is my life.
Yeah.
And after that, getting into treating cancer, to be very frank, it was kind of by chance. I also didn't have much idea about how to deal with cancer or what are all the options of cancer before I actually got myself engaged into it, because I always believe to take life as it comes.
Okay. How amazing sometimes the life has its own plans and it works in favor for the whole community and society. Because when you said, unfortunately, I could not qualify, I was telling in my heart, thankfully, that fortunately you did not. Okay. And I'm sure a lot of your patients would agree with me.
Yeah, many times few defense guys come to me, and I always express I could not join the defense forces, but they all said, no, you have better plans.
Yes,
so
yes.
Grass is greener on the other side. That's always the comment that they give.
True. So what we'll do is we'll start as in just reiterating and putting myself also, because I do want to get out of this podcast with a lot of learning. Okay. So consider me as somebody who has a mental ability of a 12-year-old kid. And I do not mean that the 12-year-old kid is somewhat low on mental capability. It's just that my information base is not as scientific. So we'll try to keep the conversation as conversational so that all the audience can feel, and sometimes their parents or whoever they send this video to could be engaged and learn about our conversation. So my first and very basic question is that what is a cancer in a very simple term?
Cancer basically is a disease, just like nowadays it has become quite similar to diabetes or blood pressure. It's a disease where the cells, basically our cells,
right,
they have a tendency to multiply.
Right.
Like one cell will become two, and they will multiply, go on multiplying. At some stage, they will age.
Okay.
And they will die.
Okay.
Okay. And that place, these cells are again replaced
by
new cells. So whenever the mechanism of that aging and death for that cell is lost, then the cells get accumulated there. Okay. Once they get accumulated there, then they form a mass or a tumor.
Right.
Okay. Let us say you get a wound or injury. After that, what happens? Your skin will come back, but how much skin comes? Whatever you need.
Okay.
Okay. There is a control for it.
True.
Okay. If there is no control, what will happen? You will form a lump over here.
Yeah.
Okay.
Yeah.
And that will keep on growing.
Right.
Those cells again get dislodged from there.
Right.
Okay. Let us say there is a mass is found in the lung or a breast, and that becomes enlarges in size, and then that will slowly dislodge from there and get into the circulation.
Okay.
And it is basically immortal kind of.
Right.
It's not dying.
Okay.
So it will keep on multiplying, and they are not normal cells.
Okay.
They are not the normal cells. Because they are not going through the natural process of aging and death. They are not the normal cells. They are the cancerous cells.
Okay.
Okay. So that is how the cancer grows in our body.
So these are rogue cells, but they are a part of our own body, right?
Yes. I'll simply tell you, like suppose let us say you have a son, you are giving him all teaching and everything.
Right.
Okay. He starts stealing from the pocket. Okay. Many times the instance happens that the mother knows, mother will not tell.
Okay.
Okay. Just imagine the cancer cells growing in our body without telling us anything.
Right.
Giving us no pain, no symptoms, nothing.
Right.
Okay. One fine day, when the same son who has been protected by the mother, he goes and steals outside.
Commits a crime. Yeah.
Okay. Then the police catches him. That is when the father comes to know. Okay. Now let us consider it here.
Yeah.
The cancer cells, they are growing slowly in our body, giving us no pain, nothing. Because there is no pain, we consider there is nothing to worry.
Yeah.
Okay. Then after that, one fine day, either they spread somewhere or they compress a nerve for which they cause a ulcer or a pain or something like that.
Right.
That day we come to know. Day our panic button tries.
Okay. Yeah, so they're under the layer, they are operating.
Yes, they operate under the layer, and one fine day they will come to know about it.
You said a beautiful, I do not want to get philosophical here, but just one line to my audience before I move ahead is there, trust me, pain, when the doctor said unless we get that pain. Oh, pain is such a beautiful concept of life which protects us. So please, just out of this context, do not get scared with the pain. I think this is one of the friendly things, right?
Cancer does not cause pain until it's too late.
And then it's too
late. I tell always, like whoever asks me, how to know that it is cancerous or non-cancerous.
Right.
I give them this example. You get these spam calls, right? Ki you are getting something so and so free of cost. Okay. Who gives us free of cost? No one gives us free of cost.
Yeah.
Okay.
Yeah.
So in cancer, so one lump is coming in our breast, that too without any pain, it is increasing in size. You're supposed to be alert.
Correct.
Because he is not giving me some mass without pain.
Right.
Okay. If there is pain, it should not be a cancerous. Okay, just consider it with a spam.
There are two things that I'm learning and I'm trying to simplify here is that, so usually whenever there is a cancer, there is a lump. It could be visible, it cannot be visible, that I understand.
Mostly, yes.
Yeah, okay. So for a simple person, and we'll talk majority, as in Unbinary itself stands for nothing is absolute 0 or 100%. But mostly it is how it is there. So first thing is, if there is any kind of extra lump in the body, even the mole, we should be careful if it is growing in size.
So suppose it's a mole.
Correct.
If the mole is same size for years together, we don't have to worry.
Right.
The same mole, suppose its character changes.
Correct.
Its surface becomes, surface is let us say now flat. Its surface becomes rough. It is let us say round.
Yeah.
It slightly increases and becomes irregular in shape.
Okay.
You should become alert.
Because my mom has a big one, and then usually because you are watching it, you know that there is a mole right from your lifehood. There is a high chances for people to miss any changes over there.
Yeah, many a times people just deny, or there is more than actually knowing or more than actually understanding that there is some change. It is more of the denial of the patient. Okay. They don't want to feel that yes, I have something abnormality in my tongue.
Right.
Or I have some abnormality of mass in the breast. I cannot have it.
True.
Someone who had COVID, let us say. First thing, suppose someone tells you have COVID, hey, I cannot have it.
Denial,
let us test 2 times. Let us test 2-3 times. Okay. So that denial is there in our human mind.
You also said something about the pain and the lump. Is it like in most of the cases, again not all, the lump with the pain or the lump without pain, which has a higher probability of being a cancerous?
No, always any cancerous mass or any cancerous ulcer. Let us say we can find an ulcer in the mouth. Normally you get ulcer in the mouth,
right.
aphthous ulcers.
Yeah.
They are very painful. The moment you put some food or something touches it, it will be painful.
Right.
Okay. But cancerous lesions, when they are very small, until they become ulcer and expose the actual mucosa, till that time it will not have pain.
Oh, and that's quite decisive because that's where people ignore it more.
Yes. It basically it's like you can consider वो दिमाग के जैसा होता है जो कि अंदर ही अंदर उसको खाते जा रहा है. हम तभी देखेंगे जब हम देखेंगे कि वहाँ पे एक बड़ा होल हो गया. Okay.
Cancer sounds more like a treacherous friend.
Yes.
Who is just sitting,
Yes.
Okay. That's so fascinating. This simplifies things so much for a lot of people. And before we proceed, just for the audience, biopsy, whenever we are saying, I think it's a term where we take a skin mass, a little bit of it, and we do the microscopic test around that. Right?
Correct.
If you can also add just in one line.
It's just we take some tissue. We
Okay.
take some tissue from that affected part. And just every microscopically we'll cut it millimeter to millimeter, and then we'll look at it in the microscope.
Okay.
In the microscope will give us a picture that whatever cells are there,
Right.
they are normal cells or cancerous cells.
Right.
Okay.
So the next thing I want to know is, what are the other visible symptoms or most prominent symptoms people should be aware or careful of when it comes to cancer? Other than, so we discussed about lump, and I think that covers most of it. But there are most of the lumps which is inside, the organ lumps. Are there any other symptoms people should be watchful even before reaching to a doctor?
Yes. See, what happens is many times we have certain symptoms which we ignore.
Correct.
Okay. Let us say we have a lump in the neck. We have a ulcer in the mouth. Let us say we have some swelling or hardness in the tongue. Okay. We'll definitely feel it either while brushing or something. We'll definitely feel it. But we ignore that.
Right.
Sometimes there is a throat pain.
Right.
Throat pain can happen due to, let us say, some infection. Okay. But infection के लिए जो throat pain रहेगा, that will automatically go off after you have a course of antibiotic.
Correct.
Okay. But if it is something else, it will be there even if you are taking antibiotics for 1 month, still it is continuing. Okay, many a times what happens, we go to our doctor, they keep on writing the prescription of some antibiotic, then we change the doctor, then
True.
they write the same thing.
Yeah.
But suppose some problem is persistent. It can be a throat pain, it can be a change in voice, it can be a persistent acidity, it can be some bowel irregularity, or it can be some blood you are seeing in the motion, or some blood in the urine, or some lump in the breast. Any kind of irregularity that we see, we need to see our doctor, and more importantly, we need to ensure that the doctor also checks it properly.
Okay.
And ensures that it is, because every doctor basically, if they check, if they touch it, or if they understand the exact history, there is a chance that they are going to understand that it could be a malignant or cancerous.
Okay.
There is at least a possibility.
Yeah.
So that time we should definitely do some tests,
Correct.
whatever is specific for that.
So once you build on the experience of doctor, at least now you can expedite and you can be much more careful, right? Which is a great step to proceed. That is really helpful. Now, there is one myth I always hear in the society. So, fortunately, I do not have anyone in my family, but you do get to hear from nearby or societies or relatives. And the one line which I always hear, and it's my personal thing, I don't know if rest of the people have done it or not, is that once somebody is affected by cancer, they keep coming back. How true is this myth? Is it a myth or not?
No, it's not exactly a myth.
Okay.
See, once someone is affected with cancer, we are able to completely clear it out. We try to clear it out by help of, there are basically 3 options of treatment, either surgery and radiotherapy. They are kind of local form of treatment, like you remove that or you kill that with use of X-rays. And the other one is the chemotherapy, which is like either a tablet or injection form, which will be given in the blood, that will circulate in the blood and kill the cancer cells. Okay. So when we are killing the cancer cells by any means, it is supposed to be removed completely. Okay. There is a chance that, let us say, we have removed 99.99% of the cells. Okay.
Right.
But some 0.01% of the cells, they can crop up again. Okay.
Yeah.
We don't know that 0.01% is left over or not. No one can tell that.
Yeah.
So if that is there, there is a possibility that it can come back.
And there is an important point also, because your body environment has something that has created that cancer. That environment is still there. Is it?
Could be.
Could
Yes,
be,
like
right?
It's like, let us say there is a smoker or someone uses tobacco.
Right.
And so definitely those carcinogens are there.
Yeah. So
and even it is more of, we call it as a tumor biology.
Okay.
It's the nature of the cells. It's the nature. I always explain my patients like the tumor cells are like our child.
Okay.
Like you have 2 children, and both of them, you give them tuition, and you give the same ideologies at home, you give them to same schools, but do they behave the same?
No, absolutely.
Absolutely not, right?
Yeah.
Similarly, cancer cells also, all the cancer cells won't behave the same way.
Right.
Or cancer cell in the same cancer in one person and another person will not behave the same way.
Right.
Okay. So the cancer cells basically same way like our child, they behave in the different way. So there will be also possibility that the cancer cells, even if you are giving all good treatment and all, but that fellow may be a dumb fellow, and he doesn't respond to it.
Right.
Or he may be very smart. There are many a times it happens that the cancer cells will respond to the treatment in the first 3 cycles. But after that, they become very smart.
Okay.
And they know how to avoid the drugs that we are giving.
Right.
It is the same way like for your son, you put him into a strict teacher, but he understands how to avoid that teacher and cheat that teacher after some time. And again, he flunks in the exam.
Yeah. I'm so loving this analogy, because what it suddenly gave me a perspective is that such a child is more stubborn,
Yes.
than the one who
Exactly.
listens to you, right?
Yes, yes. So
Sounded
these cells
exactly
are
like
kind
that.
of resistant. Whatever you do treatment, they won't respond.
Okay.
Many times the patients call, why it is not responding? Because it's the tumor biology. It's the tumor. First thing, whenever like the response to the cancer completely depends on first at what stage we are dealing with,
Okay.
like how early you have come.
Right.
Second is what the treatment we have done. Are we doing it in the right sequence, right way or not? Third is the tumor biology. Okay. First two things is something that it is in our control. Okay. Third thing, the tumor biology is not in anyone's control. We just have to leave it.
Right.
Few days back, I was talking to a patient who is like a very young girl, and she had a breast cancer during pregnancy.
Okay.
And she got chemotherapy and then delivered the baby. Then surgery was also done. Now she is for radiation to me. And the husband was like, "Will the disease come back?" I said, "See, your wife's whatever the disease is there, it is kind of more than 98% curable."
Okay. Okay.
As per the data that we have, her characteristics fall into 98% curable.
Right.
So let us be happy for that 98%.
Okay.
That 2% we should not be worried about because that is not in our control.
Yeah. Yeah.
For that 2%, we ask the patient to come and do a checkup every 3 months, which patients do not do.
Okay.
They become complacent.
Yeah.
ओके 3 महीना हो गया, अरे डॉक्टर तो जा रहे हैं, डॉक्टर के पास जा रहे हैं, वो ऐसे हाथ लगा रहा है, उसके बाद तो चला जा रहा है, वो नथिंग अननेसेसरी, क्यों इसको फीस दे के देखना. दैट इज द कॉमन साइकोलॉजी. बट व्हाट हैपेंस इज दैट मीन्स सपोज विल बी सीइंग 30 पेशेंट्स. 30 पेशेंट में एक पेशेंट का ऐसा हो सकता है, किसी का हम just by the clinical examination we come to know.
Yeah.
Okay.
There are so many things which is popping out, and I'm loving these stories. Is that, you know, it reminded me, my dad would always say, hey, just for 2 minutes I have to pay to the doctor, even for a cold or a sneeze, 1,000 rupees. And I tell my dad, look at that is this way, is that this doctor has spent 5 years of education, you know, another 2 years getting the specialization, all these experience, and if you're getting only for $1,000 is the cheapest thing you're getting, right? And if, let's say, we didn't find anything, but in the 50th attempt, if I get it and I have invested, let's say, 50,000 rupees, who knows, it may be saving me lakhs of rupees. So it turns out, and exactly I go through the same.
That is how the health insurance is.
Yeah.
You go on paying for years, and many people discontinue. अरे मेरा तो कुछ नहीं होता. But the year you discontinue, that year you will get the disease.
Yep.
And you will get that jolt that year only.
True.
So it's like
I come across a lot of those biases, is that, you know, because I'm into consulting, I work with a lot of business leaders, and usually I tell them very clearly that I'm not going to do anything other than talking. So make sure what you're paying is for talking. If how useful that talk is, it depends on you. So now these are very important thing. Before I quickly move ahead, because there was so much of information, doctor, and I'm trying to contain them and give as much as to the people. There are 2 major things I want to learn from you, but very quickly. First, when you do the physical examination, are there particular areas where you check? You just cannot do the whole body, right? So are there particular areas where we should, as in like, may it be male or female, right? What are the areas we should touch upon and see that these are the most prominent areas based on your experience?
See, as doctors, we are taught the clinical examination, that the first part of our course in our 3rd year of MBBS, when we enter into the clinical the division of the MBBS course, the first thing that is taught for a year or so is how to do clinical examination. Okay. Means what are the body, where to look for let us say we get an ulcer.
Right.
Okay. We have an entire book.
Right.
Just to explaining how to explain the ulcer.
Yeah.
Patients will fail or pass if they cannot explain the ulcer.
True.
In MBBS.
Okay.
That's how it is. So let us not really look at what doctors need to check. Yes, I will put it like this. What we need to check.
Right.
Okay. Like for females, okay, especially above 40 or 50 years, there is something called a self-breast examination. Okay. You'll find lots of videos in internet about self-breast examination.
Okay.
That's a very good tool to detect a lump or a mass in the breast at an early stage. Okay.
Right.
So those things we should tell our listeners.
Okay.
That Self-breast examination. Look for how the self-breast examination is done in the internet. In the YouTube, you will get thousands of videos. Okay, but everyone should be aware about it.
Okay. Right.
Okay.
So breast goes. Are there the particular joints or
joints,
the
etc.
thighs?
See, it's a wide term. So
Okay.
explaining in this is difficult. Yes, I will tell like this. If you find any ulcer, any mass in any part of your body, which is painless, which is increasing in size. Painless means it's like it is giving you free. Someone is giving you free of cost. You imagine it like a spam.
Yeah.
So someone is giving you free lump, and it is increasing in size.
Right.
Okay. Then definitely you should consult a doctor, or some symptom which is not getting relieved. You are
Okay.
seeing your doctor, but the doctor is not exactly properly examining you or putting his time for you. Suppose you are telling that you are repeatedly having gastroenteritis, you are having acidity problem for 6 months. But if no one is advising you for endoscopy, then definitely you should be alerted.
Right.
Okay.
One more bigger problem with the cancer cells is that they multiply in like
Geometric progression.
geometrical progression. So even at 2 or 3 weeks, it just doubles the size. So just be careful. Maybe if we get time, we'll get deeper into it.
Yeah.
Okay. So taking the now next shift is that, as I told you, doctor, that this season 3 was more about women leadership. And since this opportunity came to meet you, I didn't want to let it go. So giving a little bit of angle, towards women health. Okay. Is there a difference? Does the cancer cells are biased towards a gender in any ways?
Cancer cells are not biased in any ways, but we are biased.
Okay.
Okay. Yes, we see a lot of female cancers in the terms of breast cancer
Right.
and cervical cancer. They are the most common causes of cancer that we commonly see. And nowadays, breast cancer is increasing because of the lifestyles. It's more in the urban area, and the cervical cancer used to be more in the rural area.
Okay.
Like the 10 years back, the number of cervical cancer patients I was treating, nowadays it has almost reduced to half.
Okay.
Okay, maybe because of the awareness, or maybe because of the hygiene, improvement in the hygiene, or safe sexual practice, and even nowadays there is something called as human papilloma virus vaccination.
Okay.
Those things are catching up.
Yeah.
Those things are catching up. Breast cancer, yes, we are seeing a little bit of more incidence of breast cancer, and very positively, if I tell, we are seeing more early stage breast cancers.
Okay, so that's positive.
That's very positive. We are seeing, because people are getting aware,
Okay.
and they are coming out that I am having a small lump, and that makes a lot of even outcome differences. Like the breast cancer, if they are detected at early stage, one is they are curable completely. Second, most important is we don't have to remove the entire breast.
Oh, that's
Okay.
so-
Earlier days when we used to remove the entire breast, what happens is, let us say the patient, today you have the fear that I have cancer. So you will say, नहीं यार cancer को पूरा निकाल दो मेरा body से, remove it completely, I will be free of it. But the person will survive for 6 months, 2 years, 5 years, maybe 10 years and more. When she comes into the normal life, okay, every day she is going to think that I don't have my breast.
Yeah.
Many people will have that psychological and social thinking that my husband doesn't like me because I don't have my breast.
Absolutely. Yeah.
Okay.
Yeah.
So that social and psychological factor is a important thing.
Yeah.
So nowadays we don't consider to remove the entire breast. We remove the part of the breast and augment the treatment with radiation. Okay. And the outcomes are similar.
Right.
There has been a lot of research on that. Outcomes are similar. I'll tell you one incidence of my patient. There was the daughter and the son-in-law came, and they were like, no doctor, remove the entire breast, and we don't want the cancer cells to be in the body.
Okay, so it was son and daughter-in-law. So the patient was little
patient
aged.
Patient was outside. So they were like, don't.
What was her age, if I just may?
Patient was 70 plus. 70
yeah, because psychologically these things play.
So these people are like, she's aged, what is the need for the breast?
Okay.
They tell. But when the patient came in, so
Sure.
I sent the relatives outside to examine her, and so me and my nurse were there, and she told me one thing. Doctor, she is a very she's an educated lady,
Okay.
and she understands everything. Doctor, I understand that I am affected with breast cancer. I trust you. I have one request. Don't remove my breast.
Oh.
You do anything you want.
That's so
Okay.
human. Yeah.
So here another thing comes is
Yeah.
we think that the relatives think that we don't need she doesn't need the breast.
Yeah.
But it is her part.
Personal call. Yeah.
It's her personal call.
True.
She is supposed to decide.
Yep.
Okay.
Yeah.
So nowadays we basically inform the patient
Mhm.
about the clinical situation.
True.
We give the option to them. And if you tell me personally, I counsel them to retain the breast.
Okay.
Until and unless it is clinically implicated that you have to remove the breast.
Okay.
Okay, there are
Yeah,
certain
yeah.
situations in the clinical situations where we should not preserve the breast.
Okay.
It can be dangerous for her. In
Right,
such
right.
situation, we tell that no, we need to remove it. Otherwise, we try to save the breast, because it is not that we are going to we are going to cure the patient from the cancer. We also look about the psychological well-being or the future quality of life.
Absolutely. I think the confidence contributes so much into the way we live. And, when you are talking and when we are having this discussion, wearing this lens, I realize how blessed we are to have a normal physical attributes. And
Exactly.
just once you go on that stage, you just want to retain what you have.
Yes.
But when we do not just value it, we just take it for granted. Right?
Many of the times the son and daughter, they will tell, no, you do this. I usually feel like, suppose you will get old, you get some disease.
Yeah.
I don't think you will like your children to
Dictate terms for you.
the terms
Yeah.
of what is the treatment. Secondly, they tell my mother will have heart attack.
Right.
I usually tell them, that heart attack happens only in movies.
Yeah.
In real life, he is your father or mother. He has seen the world minimum 30 years more than what you are seeing today.
Yeah.
Okay, you are getting him here. There is no way that he is going to get heart attack listening that he has got cancer or something. Yes, we have to break the bad news in a way that she understands that yes, I have got some problem, but it is something that I got a solution.
Okay.
Sometimes I tell my patients, like,
Right.
you are suppose walking on the road, and suddenly you find a bike or a car is coming in front of you, is losing its control. Okay, and you're standing and you're looking at it, it's just hardly 10 feet away, and that time you have to decide. You have
Sure.
seconds, fraction
Yeah.
of seconds.
Right.
There is a nala in the there's a drain in the right side. You just have to jump or you'll die. So you
Die.
decide what you have to
True,
do.
true.
Now I will jump. So you have to jump. Even if it is dirty, you don't like it, or you may get hurt, but
Correct.
you are going to survive.
Yeah, that
So-
may not be your first choice, but this is how.
This
yeah.
is the situation that we are in.
Correct.
We have a situation, it's not a normal thing. We have got a disease which is called as cancer, but we also have a situation which is curable.
Yeah.
So why not think in that the glass is half full rather than calling it that it is half empty?
Right. In fact, my book is all about survival, so this story fits so well over
I'll
there.
make it half empty.
Okay, so now I'm clubbing two questions because we are more than half of the podcast we are in, and there is so much that I am curious about, and I'm sure so are the our audience. But just I'm trying to make most of your time and my time. Is I'm clubbing two questions, and then we'll move further. Is that there is a author, a very big author globally. By his name is Peter Attier or Pater Attier something. He talks and he says very clearly that in today's world, the way the medical advancement has happened, no one should die of a prostate cancer or a colon cancer. But he does say that the breast cancer and the cervical cancer are much more complicated. What's your quick view onto that?
I don't feel like that. Yes, all cancers are different.
Okay.
Nowadays, even cervical and breast cancers are kind of curable.
Yeah.
We see in my clinic, almost I see regularly patients whom I have treated more than 10 years. Okay, cervical cancer, even many of them are cervicals 3B.
Right.
Okay, and they have been treated with just chemo radiation, they're curable. breast cancer is also it's curable. So it's not, we should not think about what cancer we get. Cancer, kidney cancers, they're very dangerous. They're kind of, if they're operated in the right time, that's the only treatment that we have. But there are many patients who are of kidney cancer who were operated and they're also doing fine. So let us not consider that Konsa cancer, this has got cure, this doesn't have cure, nothing like that.
Let the doctor decide.
It is. Let us take the life as it comes.
Yeah.
Jo aata hai, we have to see that.
Correct. Okay. Very quickly, if I would like to know, because it came in our discussion, is what are the different stages? When you say stage 1, stage 2, stage 3, for a common man like me, what does it make sense like?
I'll tell you that the common man should not actually think about or discuss about this stage.
Okay.
Why? Because that's a very complicated thing.
Okay.
The common man idea is stage 1, stage 2 is curable. Stage 3, stage 4, I am not curable, I am going to die. Okay. But that is not the thing. Okay. The stages are basically defined as a common language for the clinicians.
Okay. Makes
to
sense.
Decide on what kind of treatment we are supposed to give.
Right.
Okay. Unfortunately, we as common men, we have, like, we read only the headline of the newspaper and will decide Modi ji has done this or Rahul has done this. Okay. And we don't go deep into it.
Yeah.
And in fact, until you read that many years, you also cannot go deep into it.
True.
Okay. So many times patient will just ask me a blind question. What is the stage? So I tell, what you will do with the stage? You will go and tell your relative that I am in stage 3. Then you will tell that you are going to die.
Okay.
Okay.
Not helpful.
That's not helpful.
True.
So we should not think about what is the stage of the cancer. Okay. That is beyond the scope of the individual level. That is basically designed for the clinicians to decide on what is the treatment that is going to be done.
Right.
Okay. Based on your stage, your disease, like let us say that is not like one size fits all, it's not that kind of thing.
Right.
Okay, let us say for breast cancer, stage 3, it is quite curable.
Right. Okay.
Cervical cancer, stage 3, it's quite curable.
Okay.
But it is not the same when it comes to pancreatic cancer or stomach cancer or lung cancer, like that. So every cancer will have a different entity. Okay. So having which stage, that kind of generalization should not be done. Whoever gets that word or hears that word cancer should go with an open mind, because it is individualized from our body. In our body, other than the hair, which is dead cells, and the nail, every part of the body can get cancer. Okay.
Wow.
And every part of the body, the cancer is different. Their nature will be different, their approach will be different, their treatment will be different, their outcomes will be different, their side effects will be different.
There is another side to it, Dr. Suman, is that, doctors are humans too, right? And how do we not know that they have the human biases? Is that just not the biases, but it could be the human error also, right? And when you go to machine, because there has been a story which has been gone very viral, and I just want to read you out, is that, there is a patient somewhere in US where 17 doctors said no to that child for 4 years, and the child was in pain. And then ChatGPT, when her mother fed into all the information, the ChatGPT gave an answer. When she went to verify the doctor, it came to be true. Now, I do not want to promote it as the ChatGPT, but I'm just saying the simplest possibility for me as a patient.
I'll tell you one thing. See, when a patient comes to us, okay, so there is something called as evidence-based medicine.
Okay.
Nowadays, those days are gone, that you see a senior doctor or see a doctor and he feels that, okay, we'll give some chemo, we'll give radiation to this. So that day is gone. Now, we call something called as comprehensive cancer care.
Okay.
Where the medical oncologist, surgical oncologist and radiation oncologist together have to decide what is the treatment for this cancer.
Wow, that's a nice one.
Okay.
Yeah.
Let us say for breast cancer. Breast cancer needs surgery, needs chemotherapy, needs radiation also. But which one should be given first? Which one should be given second? Which one should be given third? Has to be decided based on the nature of the disease.
That's so comforting to know.
So it is again, that is based on, like, it's not what I feel.
Right.
It is what the evidence tells us.
Mm-hmm.
Okay. If those 17 doctors have told that particular thing may not help because there was no evidence for that.
Mm-hmm.
Okay. There was no, it could have helped that patient.
Right.
You don't know.
Yeah.
Okay. It could have helped for that. Many people come and tell that Ayurveda helped me for this cancer.
Yeah.
Okay. But do we have the research papers?
Clinical evidence.
Yes, clinical
you need that.
research papers for that particular cancer, for that particular medicine. Do you have that?
True.
Okay, so if there is, whatever the doctor will tell is evidence-based medicine.
Yeah.
Many a times it happens with me also, that when I talk about evidence, okay, when I talk about the evidence, patient do not want to accept that. There was a patient who had a throat cancer, and he was a 75-year-old patient, and suddenly he was admitted with a UTI, urinary tract infection. And because he's 70 plus, I just got a PSA done, and we came to know that he had a prostate cancer. Okay, we also confirmed it with a MRI. The patient was not interested for a biopsy. Okay. Then after that, the patient wanted me to do the treatment without a biopsy. Okay, because he was being treated with other cancer. So that time I just started him on an injection which is done for that. Okay, and with a caution that, see, we should be doing, but because of these limitations, we are just starting it now, but at some point of time we have to do biopsy. After that, what happens, after a year or so, the patient progressed on the prostate cancer. Okay. So the patient, if the patient progresses on the prostate cancer, that means that medicine is not working. Whatever the tablet,
so when you say progress, that means the cancer got elevated.
The cancer is progressing, is increasing. That means the medicine is not working. So further treatment should be done with a biopsy. Again they came to me. I told, see, now I am not, the situation in that time was different. COVID time, and your father had stenting, so we cannot give those, stop those blood thinners, we cannot do the biopsy at that time. All those things were there. We had our limitations, for which we started something out of the book, but now, no.
Right.
I cannot, if I treat, I am wrong in that. Then after that, they changed the doctor. They changed the doctor. They went to another friend of mine. Okay. But it's okay.
Right.
We are supposed to advise them the right thing. Many a times patient don't want to hear what is right. They want to hear what they want.
So true.
So the what normally the people will tell, majority nowadays in India, I can say that the practice has changed a lot, and what we commonly speak is something called as evidence-based medicine. Okay, evidence-based medicine. There is almost all the hospitals, majority of the hospitals, they do have their kind of tumor board, where the decision for the treatment is decided based on the information which is shared to the common platform of all the doctors, and the treatment is decided there. Yes.
It's an initiative by a particular company?
No. It's a norm. It's a norm. Tumor board is a mandatory for cancer. It's a norm.
Wow, there's a background story which is so powerful and so important.
It's a mandatory for cancer.
It gives so much of comfort for me being on the other side of the table. And you said something and I skipped that question, but now since you said I want to do, but I needed the answer in one or two lines. What do you think as in a doctor fraternity about this second opinion?
If there is a second opinion, we should be open to taking a second opinion or giving a second opinion.
Right.
What I believe is we should trust the right opinion.
It's right.
We should trust the right opinion. We should give the right opinion.
Correct.
As a doctor, we should give the right opinion. As a patient, you trust the right opinion.
True. But that's ideal world where we expect everybody to be right. And what I have done in my life, where I was really scared about something, I really talk to the doctor and I say, hey doctor, would you be okay if I go for second opinion, because this is where I'm feeling that I'm not very sure. And they have come very positive to me that, you should. And here is the recommendation, or you should talk to this doctor.
Exactly. See, it's fair enough for a patient to take a second opinion. It's fair enough to take a second opinion. It's never a problem. And as I told, second opinion is never a problem, but you should have that maturity to take the right opinion.
In fact, that's so amazing, because now I want to conclude this one with the same note. Is that now? But before I do that, you telling me about and our audience about this board or the tumor board is so comforting, because for a disease like cancer, for a disease something related to kidney or heart, even if you go for second opinions, that's not sufficient. But when you have something, a portal where you're putting in there tens of doctors, hundreds and thousands of doctors, trust me, that's way more comforting and way more as in assuring. So thank you for sharing that knowledge, and this is for every one of you. And you also said about getting the right information. So with that, I want to conclude this particular section. Is that people, I do marketing. I have my own creative agency which is very much in marketing. And the problem with Google is what doctor said is not only just the information, but the most of the people, they are stuck in the first page of the Google search what that comes. And trust me, all those first pages, now Google has started refining it. There are some authentic source. But usually it's a SEO game. If I'm a blogger, if I write any crap, and if I play the SEO game right, I can put my website very much on top. The way I see internet is more like the society where all kind of talk is there. If you write, is cancer dangerous? You'll find all the article about dangerous. If you write, is cancer not dangerous? You'll find all the articles which is not.
So even ChatGPT.
Correct. Even for anything. Because the source is the same as all the data which has been dumped. So I think what doctor is trying to say is that you got to trust your instincts, as in you got to develop your instincts, that what kind of information you are collecting. For example, are you listening to a podcast, or you're just listening to a movie you have seen on cancer, and then you come back so these things are very important.
Trust our doctor, like the opinion that the doctor who is explaining you, they have their own clinical regions.
Right, yeah.
Okay, they have their own clinical regions. And let us say one patient, I say that, yes, we can avoid the treatment. At the same time, some other doctor may tell that, yes, we can do the treatment.
Yep.
They may be having some evidence to it. They may be having their own clinical decision. We cannot say, see, he is right or this person is right or wrong. So it is again to the patient's discretion to really understand whom to trust and whom to who is right or wrong. So those things.
Spending a time, with you, and now I'm so much interested into all these medical procedures. In fact, I would say, guys, you've got to. You do not have an option. The reason being, even if as a doctor, as a human, if they are wrong, they are much right than you. It's a relative game, okay? And then the second thing is that the kind of apprehensions we have in our head, at least we have somebody. The one very important thing that I want to share with you, because I've been in US, I've been all across the globe, and I've been talking to a lot of medical experts also over there. The beauty of the Indian doctors is that, and you also said in a story that I am going through certain disease. Let's say example you took for the prostate person. If my father has a stent and if I want to delay, the doctor considers those situations, right? But if in a particular manner you have certain way of doing the practice, you say, hey, you need this treatment, you should get it. But the doctors are also flexible.
I'll tell you one thing. Many times patients come and patient's relative come, will my father tolerate?
Yeah.
Okay, will my father take this treatment? I always tell them, see, for you, your father is your father. For me, he is also as important as that.
Right.
As a patient, he is also as important to me. I am not going anywhere from this world. I am going to be here.
Yeah.
You are going to be here. I am going to face you. If I am going to do anything wrong, I can't face you.
Yeah.
Okay. No doctor who is kind of has conscience in his mind will ever try to do something wrong for the patient. Okay. Always will try to do something which is good for the patient. And the clinical situations may vary. Clinical opinions may vary. Someone may be updated, someone may not be updated. Right. Whatever it is. But they will always do with the interest that the patient will be benefited.
How can you be so sure about all the doctors? Is that why doctors would be so much cared about us? Other than just,
I need not to be really worried about other doctors. I can tell about myself, okay, because every individual is individual.
Right.
I always see my patients, like a patient comes to me for consultation, I always feel like if I would go to a doctor, how he would treat me. Suppose a patient comes on the first day of their diagnosis. I know that they don't have any idea about the ward cancer. They don't have any idea about the ward radiotherapy. they're all scared. Okay, and what I do is I spent nearly 45 minutes, more than 30 to 45 minutes, just explaining them what is the disease, what is the process of the treatment, what are the side effects they are going to face, and just the thing is that I always tell them,
Right.
the moment you become comfortable, you understand that this is not a big deal,
Right.
then your treatment is also going to be very simple.
And do they teach you all these things in your medical colleges, or is it something?
No. See, medical college, etc., we don't get to see this. Yes, to a lot extent, our mentors, like the people under whom I worked in Hyderabad, Dr. Bijayanand Reddy, Dr. Kaushik Bhattacharya, Dr. Sajal Kakkar, and so the things that I learned from them have worked a lot.
Okay. For this section, before I want to know about you as a personally, as a human being also, here is my last question to this. Are you excited about the new advancements in AI? Do you think that will enable our diagnosis system?
We see AI, we do use AI, not exactly diagnosing the things. There are certain nomograms, helps us to give the prognostication.
Okay.
They're kind of AI based. Even for certain like technical things like radiation planning or radiation contouring, we do get some AI help, and that also makes it more faster. Like now we have the facility that suppose we are treating a bladder cancer. Okay, you know the bladder, it gets filled. That is not in our control. Okay. Every day we cannot have the same bladder volume.
Oh, okay.
It can today, suppose now it is 650, it can be 700. We can control it to some extent, okay, by giving particular amount of water and waiting for a particular time, this much, but it will not be accurate. Okay. Now the technology has come that we can do something called as a plan of the day. That means now whatever your bladder is filled, I am going to do the planning. I am going to, within 10 minutes your planning will be done, your treatment will be delivered.
Awesome.
Okay,
Yeah.
so those are the advancements. So AI will help us. We have to learn how to use it.
Right.
We have to learn how to use it.
Right.
Okay, I have made my department completely paperless.
Oh,
Okay,
yeah,
that
that's-
is one of
yeah.
the few centers in the country.
Right.
Okay, completely paperless, from the patient entry to the patient discharge. That reduces all the errors. Like you go somewhere in the radiation department, you will have a what you call a diary kind of thing, which will be everything will be entered. There is a chance there could be error in that. Okay, here online, this computer, there are menus. We have to select that. I will do that. My colleague will recheck and approve. So all those protocols. So these are the technological advancements which we are using it for our positive thing.
Right,
so
right.
in Apollo Hospital, we follow that protocol.
And other than this AI, as a doctor, what do you feel about this? The complementary therapies which is out there, like say Ayurveda, Unani, and all. What is the opinion in the doctors' fraternity?
I'll tell. I am not exactly qualified to tell that something is working or not working. Like Ayurveda, I have respect for the Ayurveda, homeopathy, and all that. But I always believe that we should trust whatever based on the data. Data in the sense, let us say, recently we had a very funny incident, I'll tell you. Last year, nearly 1 year back, one patient came to me that he has been repeating the PET scan for his lung cancer for 3 months. Okay, every month he will do. Then in the 3rd month, he comes to me and asks me, "Kam hua kya?" How can it reduce? You have not taken any treatment. I am praying God. Okay, I am praying God, and I believe that it reduces. Then I told, no, see, God, you should thank God that God has sent you to me. Nothing more than that.
Was it increasing or decreasing? It was doing nothing?
Nothing.
And then was it stagnant?
No, the disease was increasing.
Increasing, okay.
I don't know, how do you expect it to reduce when you're not doing any treatment?
Yeah.
Then the disease was completely curable stage at that time. It was an operable tumor. I nearly spent, you won't believe, me and my colleague, surgical oncologist, we spent nearly more than 2 hours. Even one time it happened that I was going home. That time the patient was entering. I came back. I was actually, because it's a curable disease and that person is neglecting. I again came back. I tried to convince him, but anyways, he didn't come back. Ironically, he comes back again after 1 year. Okay. Why he has come back, he has been taking some Japanese herbal therapy, okay, with some guy, and now they have done some PET-CT. The PET-CT, there is some decrease in the activity.
Okay.
So in the PET-CT is basically we give an injection of radioactive injection that will be taken up by the glucose will be taken up by the hungry cells. Though the tumor has increased, tumor has spread from here to the bone, and but it has reduced some activity, something. So that fellow is coming to ask me that my doctor has asked me to take your opinion whether it has reduced or not reduced.
I don't know, I can just smile.
So that is what. So we should not be that fool. There is no data to.
Absolutely.
And you're progressing disease, and this man who was coming walking, now he's coming in a wheelchair. Still he doesn't understand.
That's so funny
So
and
that's
stupid.
the denial. That's the denial.
Correct.
People, and some people take advantage of it. Some people take advantage. I never tell the Ayurveda is bad, but I don't support those people who make these vulnerable. These people are vulnerable.
Yeah.
One person, she had to put a bag in the motion tract, okay, because she had disease affecting the sphincter. She was not interested for that, okay. She then, one Ayurveda doctor told him that I will cure this, you don't need any bag. She was taking treatment for, then after, actually I know her relative. So one fine day I met him, what happened? She didn't go for surgery. No, this is what happened. I told, okay, please ask her to come and meet me once. Then what I did was, I told her, please connect me the phone and put it on speaker with that person. Then I asked that person, please tell me, I am a relative, what stage it is and what is your treatment plan? When after talking to him slightly for 2 minutes, then I asked. Then that fellow could not answer and disconnected the call. That is when this lady could understand that I have been cheated. But it was too late by that time. So this is the thing that, see, if there is evidence for a particular disease, for a particular type of therapy, okay, welcome.
You still have reasons to trust.
Yes. Let us say I am going to give so and so drug for this particular disease. I have got thousands of research, I have got thousands of papers to show that. Without papers, if I am doing, my colleagues themselves will ask me how you are doing this. This is not ethical.
So with all that, doctor, the last 10 minutes I want to spend about you as a human, right? I have been connecting with you and I know so much, that you are so much more than a doctor, okay? How is your life outside the hospital?
I keep my life very simple. I wake up at around 5, do my routine exercise. I keep running. I do marathons. Even I've done full marathons, and I do cycling. So I have a schedule. I have a kind of a mentor for training also. I believe mentors are very important in any part of the. It can be shaping our own life, or it is like shaping our own house. We need mentors. After that, we go to the hospital around 9:30, and I'm completely engrossed there up to the evening. And after 6:30, I'm back at home, and till around 9:30 spent with my kids.
How's your family supporting you to be such a welcoming and open-hearted doctor?
Family is very important. Family is very important, especially our parents and especially our spouse. And they're very, very important because we have a busy life. And to be very honest, I don't be able to give all time to my children. And I am able to work good in my hospital just because that part of my life is taken care by my wife. After my parents are staying with us, lot of disciplinary changes in my kids we are seeing also. What happens in this generation, me and my wife, we ignore small things correct. Which were not there in our parents generation, but they are also very important. Now after my parents are completely, my father after he had some heart issues, So I got them to my place, and after they are staying, I saw such a great change in my kids' discipline.
So, what I have here is something that I got from Dr. Suman as a gift, a souvenir, it's a collection of the pictures that he has clicked, and then if you could see, he has created a calendar out of it. So that's so awesome. Tell us quickly about your hobbies, because I know that you have quite a lot of them.
Yeah. So firstly, I am a photographer. Like I took photography kind of by interest. I think I was telling you, one of my senior colleagues taught me how to hold a camera. I believe like photography, like nowadays you have a mobile, so everyone is a photographer now. But do you like everyone's photo?
Yes.
No. The one who makes it into a great frame, that is what makes a good photographer.
Sure.
Okay. Similar is the life. We'll see so many good lives. But those are the people who get it into a good frame, are the people we remember, or who make positive change in the society. So that we can relate to photography. Then I play tennis, and tennis gives you that positive attitude. Okay, it's the time like you're down 40 love, you're down, and from there you're trying to win that set. So that thing gives you the winning attitude.
Right.
And then during the lockdowns, first lockdown, when tennis was also stopped, I was like, something kuch to karna hai, and that time I luckily got hold of a cycle.
Okay.
So I started doing cycling.
Wow.
And I did long distance cycling also. I did 200 kilometers BRM. But unfortunately, I didn't feel safe in the highways. So I reduced it a bit and then got into running.
Yeah. I'm so confident that you are living a very healthy and a complete life. And many a times when I talk to my leaders, I ask them, do you have the ability to run when the dog is not chasing or you have to catch a bus? And thank you so much for this beautiful calendar, doctor. We, right from all the audience fraternity and from my side personally, we really wish you all the best for all the knowledge that you have shared, and what an amazing doctor you are. I'm sure there's so much more to come to you, and all the good things that you bring to people, to the families, and the most important is the life. Coming back to the audience, if you are still with me, I think that has been one of the most important 1 hour that I've spent, and there is so much for me to take away from here. For doing this podcast, it's not just two of us, but there are a lot of people who are behind the camera. Even the space where I've traveled to Vizag, a lot of people have helped us. For sure, I'll leave a thank you note for them, but I just want to thank all of you for your support in getting this episode done. The one thing also I want to tell to the audience, that if you have any questions, feel free to send me an email over hello@unbinarylife@gmail.com, and I'll make sure to get your questions answered by the doctor and send it back to you. With that, I would take a leave. Thank you so much for being such a lovely audience. Thank you so much, doctor, for being with us. It was a pleasure having you here.
Thank you.
Thank you.